Good evening, everyone. On behalf of the Multicultural Health Foundation and Mental Health America, we thank you for joining us this evening. I am Monique Brooks, the Director of RE3 Christian Counseling and Mental Health Ministry at Bayview Church. We are excited to be here with you, and we have an engaging and enlightening program planned for you this evening. Thanksgiving is traditionally a time when we come together to celebrate and reconnect with friends and family. However, the COVID-19 epidemic is worsening, and small household gatherings are an important contributor to the rise in COVID-19 cases. Tonight, our panelists will share ways we can all celebrate Thanksgiving this year while keeping our families and communities safe. Additionally, you can learn more about COVID-19 and particularly how it impacts the Black community by visiting blackcovidfactssd.org. The link to the website and Facebook page will be sent in the chat. Before I get started, here are some housekeeping directions and a few quick tips on how to use Zoom. You can use the chat feature to submit questions throughout the program. We have a team who will be monitoring the chat in case you have any questions for any of our panelists to answer during our Q&A segment. If you have any connection issues, you can try exiting the Zoom meeting, quitting your web browser, and then rejoining. That usually does the trick, but we will also be recording this event this evening in case anyone does run into any technical issues. Before I present the agenda for tonight and introduce our speakers, we would like for everyone to participate in a poll. It's an anonymous poll, so please be as honest as possible. Tonight's poll question is, do you plan to have a gathering at your home, or do you personally plan to attend a Thanksgiving gathering in someone else's home? Take a few minutes and answer those questions. Thank you so much, everyone, for participating in our poll. We will have another poll towards the end of the event to allow us to see the effectiveness of our program this evening. Our program tonight, as you can see on the screen, will conclude at about 7 p.m. To begin, we'll hear from Dr. Vangie Acridge, who will be sharing techniques to overcome the emotional challenges of not having a traditional Thanksgiving gathering. Dr. Akridge is an educational psychologist who specializes in psychological educational assessment, special education law, specific learning disabilities such as ADHD, mental illness, alcohol, substance abuse, and other factors that impact our teens. Then we will hear from Dr. Suzanne Afflalo. I'm trying to get your names correct, Dr. Suzanne Afflalo, who will discuss preventive measures and the safest way we can keep you and your family safe this Thanksgiving. Dr. Afflalo is a current board member of the San Diego Black Health Associates, as well as a member of the COVID-19 Equity Task Force and a board member of the Multicultural Health Foundation. Lastly, but certainly not least, we will hear from Dr. Aquila Weber, who will cover ways to keep our children stress-free during the holidays and during the time of isolation. Dr. Weber is a board certified obstetrician and director of the Pediatric and Adolescent Gynecology Division at Rady Children's Hospital, who has made history in 2018 by becoming the first African American to be elected to the La Mesa City Council. After Dr. Weber's presentation, we will conclude with the Q&A segment and some final comments from the speakers. With having said that, please let me introduce to you Dr. Vangie Acridge. Dr. Acridge, again, as I mentioned before, is an educational psychologist who graduated from Alliant International University in 2013. After being a psychologist in the schools for approximately 15 years, she has handled on the challenges that children today are faced with. She has expertise in psychology, educational assessment, special education law, specific learning disabilities, ADHD, mental illness as it pertains to school functioning, alcohol and substance abuse, and other factors, again, that impact our teens. Dr. Acreage can address family and youth needs. Being a teenager can be hard, and being a parent of a teenager can be very challenging. Knowing that we all desire for children to be emotionally well, adjusted, and academically successful, it is sometimes necessary to seek support. Dr. Akridge is available to support families throughout the journey of adolescence and can provide valuable information about children's learning abilities and emotional functioning to navigate the education system. Dr. Akridge reaches families to let them know they are not alone. She's here to provide the support that families need in facing emotional changes. We'll hear from her in just a few moments. Dr. Suzanne Afflalo, MD, received her medical degree from George Washington University School of Medicine in Washington, D.C., and completed her family medicine residency at Kaiser Permanente Medical Center in Los Angeles. Dr. Afflalo retired in 2015 from Kaiser Permanente after 23 years of service, but she did not retire from her passionate work to improve the health and wellness of the African American community in San Diego. Not only has she been instrumental in the Susan G. Komen Circle of Promise African American Breast Health Initiative, she has created and runs an innovative healthy living lifestyle change program called A Healthier Me. Dr. Afflalo has received multiple awards to include the Kaiser Permanente San Diego Family Physician of the Year, the National Black Police Association's Community Outreach Award, and the Dr. Antoinette Yancey Community Education Leadership Award, just to name a few. Dr. Afflalo is currently a board member of the San Diego Black Health Associates, which allows her to work directly in the community doing health education, health screening, and outreach. She also serves as the Southeastern San Diego Community Advisory Committee, which provides an opportunity to develop and promote culturally appropriate health policies that improve the overall health of our local community. She partnered with United African American Ministerial Action Council to work with 20 faith-based organizations, teaching them how to use the A Healthier Me tracker to gather blood pressure data at each of their churches or organizations. Dr. Afflalo also serves as a member of the COVID-19 Equity Task Force, as well as board member of the Multicultural Health Foundation. Dr. Afflalo is a tireless community advocate who uses her medicine skills to help meet the diverse health needs of children and families in the Southeast San Diego community. We're excited to hear from you this evening. And lastly, Dr. Aquila Weber is a board certified obstetrician gynecologist at the University of California, San Diego. And she is also the director of the Pediatric and Adolescent Gynecology Division at Rady Children's Hospital here in San Diego. A native San Diegan, she graduated from Xavier University of Louisiana in 2000. Dr. Weber earned her medical degree at the University of Rochester Medical and Dental School in New York, completed her residency at John H. Stroger Hospital of Cook County in Chicago, and completed a pediatric and adolescent gynecology fellowship at Cincinnati Children's Hospital Medical Center. Dr. Aquila is an active member of her community who volunteers her time giving talks to various churches and community organizations. She is very passionate about giving back and serving as a positive role model for the youth and exposing them to careers in the STEM fields. In 2018, Dr. Akila Weber made history by becoming the first African American to be elected to the La Mesa City Council. When not working, Dr. Weber enjoys reading, traveling, and spending time with her family and friends. She is married and has two young sons, Kadir, age 8, and Jaleel, age 7. Please welcome to our panelists. Please welcome each of our panelists to this evening. And now we will hear from Dr. Akridge.
Good evening, everyone, and thanks for joining us. As was mentioned, my name is Dr. Vangie Acreage, and I am a licensed educational psychologist. My private practice, Metro Consulting and Psychological Services. I provide an array of services. Next slide. I'm also the program director at Alliance International University for the school counseling and school psychology programs. I am a strong advocate for recycling my education and experience and have the opportunity to do that at my doctorate degree alma mater, training future school psychologists and school counselors. Next slide. So I wanted to talk a little bit about the challenges that the pandemic and the COVID-19 epidemic has on our community, specifically as it relates to communication. When we think about the African-American community and our history, nonverbal communication and expression, it's something that is very significant. Having come to the Americas and our ancestors having been in bondage, there was a real significance to the importance of our nonverbal communication, whether that was a nod, a wave, or a handshake, or an embrace, or even at times, humming a hymn, even if there weren't words to that hymn. It has historically been key for our physical survival, and has also been very instrumental in establishing emotional safety, and that's both past and present. Our nonverbal communication that we have with each other is something that is very important and is also something that has been impacted with this current pandemic. The pandemic, in essence, has really changed the way we communicate and interact with our community. Next slide. So in our community, it's very typical for us to meet and greet each other or even say goodbye or acknowledge each other with a hug or handshake or even giving one another dap. It is an act of connectedness. It's a way we display intimacy, way we express affection or admiration. These types of nonverbal communication also implies solidarity and unity. It really stands for a way for us to transfer energy. Sometimes that hug can be a way to let go of hurt or pain, or a way to absorb positive energy. Sorry, I lost you all there for a minute. But these acts are very significant and play a huge role in our culture. And with the pandemic, many of these things are missing. Next slide. So the impact of COVID-19 has really challenged how do we connect with one another? It has completely changed. We are in a situation where giving that hello hug is something that we have to stop and think about and really question and determine whether it's appropriate given the current health crisis. And I have to acknowledge, and speaking from personal experience, it's difficult to refrain from hugging, knowing the significance that it means, not only to our community, but specifically just to us as humans in general. I remember someone once telling me that, people who are well adjusted have at least 5 hugs a day. So here we are in a situation where unless you have 5 people in your house, or you are hugging your spouse or significant other or children in your house, multiple times a day, we don't have the opportunity currently to have that type of interaction. And I will say that it's very awkward to refrain from hugging when you come from a hugging culture. Um, you see someone you haven't seen in a long time, you're masked, you approach each other, and there's this awkwardness of like, should we hug or not hug? Then there's this question of, if I don't hug this person, am I being disrespectful? And then you sort of feel at times a little bit unfulfilled, like, gosh, I really needed that hug to, have that level of connectedness, and you feel that need for warmth. So during the pandemic and with these types of restrictions, we really are being forced to transition from sort of relying on nonverbal communication and really beginning to have to rely on verbal communication. So in these times, I think it's really important for us to work on our verbal communication and finding ways to really give our feelings words. So where before we could hug one another and without words, have this communication and understand where each person was. Well, in this day and age, and during this pandemic, it's really important that we're able to use our words to express how we're feeling, why we're feeling that way, and being able to, verbally process what it is we may be going through. We are forced now to really explicitly express, our thoughts and our feelings. And with the impact of the COVID virus and how it is impacting our families, specifically at an unprecedented rate as far as deaths, it's also this inherent urgency to communicate, not knowing when, a loved one may be impacted by the virus and how that virus may impact, them long term. Next slide. So with that said, here is some information in the event that, there are further questions that are in my lane of expertise. You are welcome to contact me. Please also note that I have a community colleague who is doing a turkey drive. And if you know of families that are in need, please put your contact information in the chat, and I'd be happy to reach out and get you connected. So with that, I'd like to introduce you to Dr. Suzanne Afflalo.
Yes, good evening, everyone. And thank you for attending the program today, the webinar today. So with that, I'm going to be presenting some information on preventive measures and the safest ways to keep you and your family safe during Thanksgiving. Next slide. So this is what a typical traditional Thanksgiving gathering look like, with plenty of people in the room, all sitting together at a table, 1 or 2 tables. And this is what we're going to try to avoid. So next slide. So traditionally, Thanksgiving gatherings with family and friends are fun. You get a chance to get together with your family. You haven't seen them in a while. Some people travel to get there. This might be the first time in the entire year that people get a chance to get together. But these gatherings are what increases the chances of getting or spreading COVID-19 and even the flu. And we're in the flu season right now. Let's follow these tips to make our Thanksgiving holiday safer. So the recommendations are to not gather this year. If we really want to see our loved ones next year, we should avoid gathering this year. The safest way to celebrate Thanksgiving this year is to celebrate with people in your household only, not mixing anyone else in the dinner situation. So do not mix family members from other households this year. So even your sisters and brothers, your siblings, your grandparents, try to avoid it as much as you can. And know it's difficult, but if we start mixing households together, we increase the risk of passing COVID-19 on to our loved ones. So the best thing to do is host a virtual Thanksgiving dinner, share your recipes, show what each household has prepared for their Thanksgiving meals, and share that on your Zoom. Next slide. Other recommendations are If you are a specific family member is actually preparing the meal for everyone, then I suggest that you drive by and pick up your meal and enjoy it in the safety of your home virtually. If you plan on actually gathering family and friends from 2 or more households, then I would take the necessary steps to make it safer. So limit the number of people that are going to be at your home to 10 or less. Hold the event outside. And I know it gets colder in the evening, but outside is going to be safer. Wear your mask, socially distance, wash your hands often, and consider getting COVID-19 testing before you even gather. That's one option. It doesn't mean you have to avoid the other things, but at least gives you an idea of whether or not you're negative up to that point and you're not an asymptomatic carrier. The things that are not allowed is under the California Department of Public Health guidance, in-person events and parties with more than 3 households together are not permitted. Absolutely not permitted, even if it's outdoors. So remember, the smaller the number of people together, the safer. Next slide. So other safer alternatives might be, we've had lots of traditional things we do around Thanksgiving, but they're all high risk for spreading the viruses. So let's try to do something safer. That's an alternative. So consider sending some pre-made Thanksgiving dinners or ingredients through online food delivery services and eat them together virtually. Or when you have your family together in that one household, watch TV, play games with the people in your household, watch Thanksgiving parade, watch some sports or movies, play cards and board games. Everyone likes to do the Black Friday shopping. So we suggest that you do it online instead of gathering in these large, long lines, fighting each other, knocking each other over just to get to a sale. So please avoid that and shop online. Participate in virtual turkey trots rather than the usual person 5K run. I'm sorry. Could somebody change that? Let's see here. Okay, there we go. I'm sorry. So yes, participate in the virtual turkey trots and things like that instead of going to the in-person ones. Those are not allowed any longer. So please avoid those because you cannot socially distance when you're walking and running together. So the things that are not recommended in terms of Thanksgiving travel, we all like to, that's probably the busiest day that people normally travel. We're hoping that that's not the case this year. According to Centers for Disease Control, we're asking people not to travel. Traveling increases the chances of getting and spreading COVID-19. Unless it's really essential for you to travel, please avoid it this year so that you can be safe and see your family next year. Staying at home is the best way to protect yourself and others. If you have to travel, check your travel restrictions before you go, get your flu shot before you travel, always wear a mask in public settings, especially on public transportation. Keep, as far as you can, 6 distance apart. Obviously 6 feet apart is not practical in the airplane, but the best you can do that. I'd actually even add putting on a face shield on top of your mask. And then making sure you wash your hands often and bring extra supplies as you travel. Next slide. And so these are just, the next 2 slides are just gonna be flyers that you can find on the CDC website on the ways how everyone can make Thanksgiving safer. And they have some tips on there. Some of those I've already pulled out of onto my slides. This is the other one, concerning other Thanksgiving activities, which I've mentioned in my slides also. So those are on the website, CDC's website, if you want to go back and check those out. Next slide. And so my biggest plea tonight, please, I'm begging you, please do not gather. These pictures of these families, huge families of multiple generations, I'm sorry, you may end up giving them COVID-19. If you're asymptomatic, you may end up putting them in the hospital and or even giving them a death sentence. So please, if you really love your loved ones, stay away from them this year. Next slide. So what I'm gonna say is just have a safe and enjoyable Thanksgiving. Keep one household together and do your virtual Thanksgiving this year. Thank you. And with that, I'm gonna take this opportunity now to introduce Dr. Aquila Weber.
Thank you very much, Dr. Afflalo. That was excellent information. As stated before, my name is Dr. Aquila Weber. I am an OBGYN at UCSD. I am also the founder and director of the Pediatric and Adolescent Gynecology program at Rady Children's Hospital. And tonight, more importantly, I am a mother of 2 young boys. So for me, this topic is very important because, oftentimes we forget about our children during this pandemic. Next slide, please. So oftentimes when we talk about COVID-19, we don't really talk much about kids or teens because we're talking about more so symptoms, infection rate, mortality, morbidity. And so because we don't see the cases as high in them as we do in other age groups, they are oftentimes left out of the conversation. However, when we talk about the overall impacts of COVID, it has affected them as well. They had lives, they had schools, they had friends, and those things have been overturned during this time as well. And so for those of us in the medical profession who actually treat children and adolescents, we have noticed an increase in the number of kids and teens coming in with anxiety, depression, those who have developed or worsened unhealthy eating or sleeping behaviors. And so it's always important to think about and include our kids and teens whenever we're having any discussions about COVID-19 or this current pandemic. Next slide, please. So the first thing I want everyone to remember is to just enjoy your time together. Before the pandemic, we were all very busy people, jobs, clubs, sports activities, and we probably didn't have the opportunity to spend as much one-on-one time with the members of our family as we have in the past. And so over Thanksgiving, many of us will be out of work. The kids, of course, will be at home. And many of them have been at home this whole time, and many of us have been working from home. So just really take the time to enjoy the ability to be with our families. First thing is get outside. Don't stay inside all day. Getting outside really helps with your mental and physical health overall. You can go for a bike ride, you can play soccer, basketball, baseball, tag, hide and seek, all of those games that, we used to play when we were kids. We're lucky here in California because we can actually go out to the beach with our mask on and walk along the beach. We have lots of lakes, hidden trails. You can do those things, keep your distance from others and wear your mask, but getting outside is extremely important. Just because we have the pandemic doesn't mean that we have to stay in our homes 24/7. You can also go out and just have a picnic, even if it's in your backyard. That kind of shakes up the routine so you're not having breakfast, lunch, and dinner inside your house. Consider developing a daily exercise routine, but also just a daily routine in general. Some kids, the shakeup of their routine, they wake up, they go to school, they've got their sports and they do their homework. The fact that that is no longer the case is very challenging for them. And so they may need to say, okay, we're getting up, you're still getting up at a certain time. And this is when you're gonna have your screen time. And this is when we're gonna have lunch. So developing a routine is good, but definitely developing a daily exercise routine. We, adults and children, have put on some weight during COVID. And so it's extremely important to get outside and make sure that you're doing something. If you have more than one child, having that one-on-one time with them is extremely important because if they're indoors with their siblings all day, they may not get a chance to have that one-on-one time with you. I know a while back, I decided that I was going to go for a walk around the lake with each of my boys individually. And so I took one on one day and I took the other on the other day. And it really gave me the opportunity to get to know them a little bit more. And they appreciate it, and I definitely appreciate it. This is a time when you and your child or children can sit down and develop some kind of nice DIY or do-it-yourself project, whether you have younger ones, it's a small little thing, or you're going to develop a garden or build something greater. If you have older children, this is a good time to really get together and do something like that. Teach games from your childhood. I was thinking this morning, I loved playing Clue when I was younger, and I think my kids are old enough to start, learning that board game. These are things that in our daily pre-pandemic routine, we didn't do necessarily a lot of because we've moved to a very technology-focused culture. And now with the kids constantly being on screen, we need to kind of pull that back when they're not in class and they're not doing their studies. Just because we will be away from our family during the holiday doesn't mean that we can't continue to talk about the importance of family. And I think doing a genealogy project is very important. Sit down with your kids and talk about where your people come from, where their father's people come from, and where your grandparents came from, and how did you end up in California or wherever you ultimately live, so that they know their lineage. Even if they can't play and be with their cousins at this point, they still understand that family is important and have a deeper appreciation of their family from learning where they come from. Next slide, please. So if you have younger children, there are lots of online academic resources if you wanted them to continue to be mentally stimulated academically over the holiday season. There are things like Khan Academy, Varsity Tutors, NASA, National Geographic. There are educational YouTube channels, podcasts that are age appropriate, even all the way down to age 2. And many of these are now free because people realize that our kids are at home and they don't really have a lot of options as they did in the past. Virtual field trips are also a great option. There, for example, San Diego Zoo and the Monterey Bay Aquarium, they have 10 or so webcams in different areas and they switch them out. So where we may not have gone to San Francisco or the Monterey Bay to see their aquarium, we can see it now. And many other museums are open for free, not only here in California, not only here in the United States, but also internationally. So you can always leave the country, but actually be able to stay at home. Scavenger hunts, inside or outside, are always fun for kids. Highlights at Home is a great website that has different daily activities, different learning activities for the kids. Developing a theme day over Thanksgiving. So one day could be pajama day, the next day could be superhero day, something to just make things fun for your kids. Cooking is always interesting. Cooking is a skill that we all need to have, and we can learn from when we're very young, whether it's just learning how to make cookies, hamburgers, or as they get older, actually creating a full meal. And the other thing is that even our younger kids are used to social interaction. And so, it is possible to create an online project that you can do with other friends or family. My cousin in Atlanta has created this Lego competition, and every month she sends out the rules and regulations, and we're supposed to do it and then send her the picture at the end of the month, and then whoever wins gets a prize. So there are things that you can do so that they still maintain that social interaction with either their friends and family locally or even throughout the country. Next slide, please. And if you have a preteen or teenager, one of the most difficult things is that you're going to want to keep them off of their phone or keep them off of playing games, really trying to continue to limit their screen time like you did before COVID. So they're a little older, they can participate and help out a little bit more. So asking them to say, hey, what do you want to do? Design a day, non-technology based. What is it that you want to do on the Wednesday before Thanksgiving? And have them come up with something, and everyone in the family participate in that. Depending on their age, a lot of the colleges have a lot of virtual tours. And so this is a good time because now you don't have to pay to go to each campus individually to look at it. You can actually spend your time doing this virtually. Again, we talked about cooking already. And teaching life skills is extremely important. One of the things that people often complain about with our teenagers and young adults is that they don't have the basic skills. They don't know how to do laundry. They don't know how to clean a house or plan a meal or do a budget or any kind of basic car maintenance, basic sewing skills, a button's off. Do you know how to put the button back on your shirt? Manage a budget. This is a great time to start teaching them those things. Kids, they're doing podcasts. They can watch a national theater or a Royal Ballet, all of which is free and online. Netflix, which is now called Teleparty, actually has a platform, and so does Google, where they can watch a movie online with their friends. So that is another option. And finally, one of the things I put in bold is to make a gratitude list. I think whenever we're in a pandemic, it's always easy to think about what we don't have or what we're missing out on. But we don't necessarily always think about the things that we do have and the things that we are able to do. And so even with the younger ones, when this started, I used to wake my kids up and we go on a gratitude walk to just be grateful for the fact that we are safe, alive, and healthy. And I think that's really important for our teenagers and our preteens because they are extremely social. And with keeping them home, it's very easy to focus on the things that they're missing. So having them focus on the things that they have is always a good thing. Next slide, please. You can definitely utilize your local and national resources. This is just a little snapshot from Rady Children's, because everyone is realizing that our kids are having a hard time coping and that they need help, and parents and families need suggestions. And so you can always go to different websites. Pretty much every children's hospital will have something, but there are a lot of local and national resources out there that will give you some suggestions. Next slide, please. Utilize your extended family, friends, and community. You know, before the pandemic, you just drop them off at grandma's house or drop them off at their aunt or uncle's house or godparents' house. And even though you cannot do that at this point, you can utilize your extended family in planning activities for them. I have a very good friend who every Sunday she does some kind of activity with her nieces and nephews in New York. And so they know every Sunday their aunt will be calling them via Zoom and they're going to do something. And that helps her sister out so that that's some time period that she doesn't have to be concerned about trying to figure out some kind of activity for them. So utilize your extended family and community to reach out to your kids and to connect with them that way and to come up with some creative ideas with them. Next slide, please. So, you know, when we're talking about Thanksgiving, when we're talking about activities, when we're talking about this pandemic, just remember to include the fact that our kids are suffering as well and that they need some kind of activity, some kind of outlet to keep them well mentally and physically. And so I'd like to thank those who have placed this webinar on. I'd like to thank those who are joining in. And at this point, I'd like to now pass it back to Mrs. Monique Brooks to lead the question and answer segment. Thank you.
So let me try that once more. Thank you so much, Dr. Weber, for that great information. Dr. Akridge, we appreciate you. Dr. Afflalo, we appreciate you as well. Great, great information. Moving right into our Q&A segment, we have several questions coming in. The three of you, feel free to unmute your mic and answer as you see fit. Our first question is, when do you think a vaccination will be available? Kind of hard to answer that though.
Yeah, I'll take a stab at that. I mean, there's so many things out in the media right now saying that there's an emergency authorization use right now that is probably coming out with 2 of the vaccines. But I would say for the general population, it's probably not going to be truly until summertime. They need to mass produce it, and they need to have, they do have a plan on how to roll it out. But it also takes, because some of these vaccines need to be refrigerated at such, low temperatures that transporting from one place to another is going to be difficult, and finding it in the hospitals where they need to have the refrigeration to keep these vaccines stable. So I would say for the general population, we need to continue to be steadfast on the things that we're doing in terms of face covering, social distancing, washing our hands, and really just avoiding anyone if we can, because even though they're mentioning the vaccines, you're hearing it on the news about, a 95% effective rate and things like that. That's not applying to us right now. As soon as they do get the small portions, they're going to be giving it to the frontline workers, the nurses, the doctors, the people that need to take care of the patients in the hospital. And then the next line would be the highest risk populations. And then we go from there. So I would say don't anticipate anything really truly until probably summertime, where we can start rolling out to the general masses.
Very good. While I have you, Dr. Afflalo, there's another question specifically directed towards you. Could you go over how to travel safely if there are still plans to travel?
Okay. Well, I would put myself in some bubble wrap. No, I'm just kidding. I mean, obviously they're saying that it is not safe. So if you truly, truly cannot avoid it, because wherever the destination where you're going, there's a ill-found family member that you need to see or something like that, you might want to rethink it. But if you're going to go, then obviously your face mask, I would add a shield onto that. I would figure out if you can find somewhere on the plane that's safe, so if they're eliminating that middle seat, that helps. Shorter distances would help, but if you're in a plane going from, a six hour flight, that increases, the exposure time. But I would just say that making sure that even some people travel with gloves so that they can avoid touching things and or touching their face, but also wipes so that you can wipe down your seat when you get there and anything that you use. Pack your own snacks because they're not serving much on there. So priority is don't travel, but if you really cannot avoid it, think long and hard and pray about it. If you cannot avoid it, then put in all the necessary precautions and making sure you check that you can safely travel where you're going and that you're not going to be stuck somewhere in an airplane if you're, I'm sorry, in an airport somewhere if you miss your flight or a connection flight, that's also going to be a problem. So if at all possible, I would say stay home this Thanksgiving.
Very good.
And I would like to just kind of piggyback on that. I agree with everything Dr. Afflalo said. I did, for the first time in the pandemic, travel, I believe last month, and it was very nerve-wracking. But what I did was I definitely wore my mask. I actually double masked while I was on the plane. And I do agree with wearing either goggles or face shield. I had my Lysol wipes, so I wiped down everything, my seat, the little thing that pulls out, everything. I also went on line and I ordered some seat covers. So they were very easy to just pull over the seat after I wiped them down. So I had seat covers, I had gloves while I was wiping everything down. And so those are the things that I would include as well.
Very good. Thank you both. Next question. My mom really looks forward to seeing us during the holidays. How can we tell her it's better we do Thanksgiving apart this year?
Okay. I would have to present it in a way that if you truly love your mother, you will stay away. So it may seem hard, but I'm sure she's not somewhere living in a bubble that doesn't understand that COVID-19 is everywhere, every corner of this earth and everywhere on this globe. So you really have to let her understand that as much as you love her, you're going to have to stay away. It's just, I would hate to think that I'm an asymptomatic carrier, go to a family member's home. You're not symptomatic at the time. You have your gathering, you go home a few days later, and the next thing you know, your loved one gets ill, hospitalized, and possibly die. So you would never be able to forgive yourself for that. So if nothing more, do not take that ownership on yourself. Just explain to your mother you love her. Do the virtual thing. I mean, we're starting to really get creative. I mean, we've had enough opportunities now over the holidays that we've had since March to be creative on these virtual platforms. Do some things, play some games, do breakout sessions, have some videos and play music, whatever it takes. But please tell your mother that, you want to see her next year. So this is the reason why you're not going to gather this year.
And I agree with that. And I think Dr. Afflalo also had brought up another point, if people just absolutely feel like they have to see each other, they have to, and they're not used to being around each other, then getting a COVID test in advance to ensure that you're not an asymptomatic carrier is definitely highly recommended. I have a colleague whose parents want to come down, and she said, well, if you guys come down, you've got to get tested before you do. So it is best to stay away, but for those people that absolutely feel like they have to be with their parents, I agree with Dr. Afflalo when she said in her presentation earlier to go ahead and get a COVID test.
And with that, real quick, I'm just gonna jump back and say, when you do get that test, because you need to give enough days to take the test and get the result, stay home. You don't want to go out, go grocery shopping, do some other things and re-expose yourself. So the minute you get tested, you end up quarantining until it's time to travel or meet with that family. Otherwise, it only says that you're negative for that moment in time. And if you re-expose yourself, you're going to have retest, which is not good. So test, get the results, but stay home during that time until you need to gather with your family.
Very good. That brings me to my next question. How do we get tested and how much does the test cost?
I can jump in on that. I'm sorry to jump in. Dr. Akridge, do you want to join in?
Well, I just wanted to acknowledge that the things that we're suggesting that families do are not easy things. Like there are lots of emotions that come to the surface when you are trying to explain to a loved one, like, hey, I can't see you, like this isn't, the best decision. So I just want to be, very upfront that these are hard decisions, and there are lots of, emotions that come with making those decisions, which then goes back to some of the things I was talking about of how can you communicate, that love and, care, concern, and missing that person without, physical presence. So it really does beg for us to be open and honest about our feelings, even if that means being emotionally vulnerable, even from a distance, and trying to find ways to create that connection. So I just want to acknowledge that, the things that we are tasked with doing right now are not easy and can be emotionally taxing.
Absolutely. And in regards to answering the question that you asked, Monique, it is, there's testing. We probably have about 60 testing sites in San Diego County right now, and all of them are free in terms of the county and the state run ones. And so you can go anywhere. Most of them now are walk-in without appointments, but some of them still require appointments. The best thing to do is go to 211sandiego.org to determine the closest site to you. And the ones that are walking, you just walk right in, no appointment. It doesn't take that long. For the most part, they're not having lines like they used to have before. And everything is free. So there's absolutely no excuse to not get tested. I actually recommend that everyone get tested, because that's the only way we're going to identify who's asymptomatic, so we can actually go ahead and quarantine them. And then, of course, the positive ones that we do find, we isolate those appropriately and make sure they stay away from the family members. The county has public hotels that they can put people up free of charge with 3 meals a day and some laundry and things like that, a nurse checking in on them for the ones that are positive. But if you actually just want to test, and if you feel like you've been exposed to someone you're not sure, get tested, but quarantine in the meantime until you get your test results back. But they're everywhere in San Diego County. There's really not anywhere that you can't find that's convenient enough to your home.
Thank
And
you.
you can get testing through the county, but also if you are affiliated with any of the major hospital systems here, they are also testing. So UCSD test, Kaiser test, Sharp, Scripps. So if those are the places where you normally receive your care, you can also get testing through them as well.
Very good. Thank you. Next question. What would be your recommendations regarding young adult children returning home from college for the holidays, specifically those using air travel to return home?
So I think we talked about some of the stuff that they could do safely on the plane. Ideally, especially if they're coming from a university setting or anywhere else, if they can get tested before they come home, and then like Dr. Afflalo said, while they're waiting for the results, just quarantine in their dorm room, then that would make them feel better about coming home and, potentially not exposing you to something, and also everyone in your household better about them coming home and not feeling like, are they an asymptomatic carrier? Do they need to quarantine for a specific period of time? So, we kind of talked about the things that they can do safely on the plane, and it's just about them getting that COVID test and the results before they come home.
Thank you. Next comment question. This is such beneficial information. Will it be shared to a broader audience?
Yes, I do believe that they're recording it and that it'll be placed on the Multicultural Health's website. And I'm sure we can probably either, if they want the slides shared, I'm willing to share my slides if the other ladies are willing to share, and send it out to the people that registered today so that they can get access to the slides. But the recording of this event will be available to the general public.
Very good. Thank you. How safe is it to be around someone who previously had COVID-19?
Ooh. That's difficult, because I don't think that they know for sure if there's immunity, and or if, at the point they may or may not be shedding virus, but they themselves who've had it, there has been cases where people have been reinfected. And so I would still do the same precautions, unless it's your family member and they've done the 14-day isolation and things like that. But anyone outside of your household, regardless of whether or not they had it or didn't, I would still be doing the social distancing, the face, masking, and the washing of hands. I probably still would not get back together anywhere with them, regardless of whether they're positive or not. we should not be gathering with anyone outside of our household unless it's necessary. But I can honestly say that because we don't know if they can get reinfected and possibly shedding virus and they're asymptomatic at that moment in time, you have to do the same precautions.
Very good. Thank you. Should people get the flu shot this year?
Absolutely. I'll just add that, and I know Dr. Weber wants to join in, but absolutely, that is almost a must. Even the people that don't believe in vaccines, I'm begging you, please get your flu vaccine, because the healthcare system cannot afford to have a double whammy of flu infected patients and COVID infected patients. And since some of the symptoms are very similar, we can't tell whether or not you have flu versus COVID. And if you if you get that sick that you have to go to the hospital and be in the ICU or ventilated, we want to at least eliminate the one population of the flu vaccine, of the flu patients that most likely will not get it, and then if you're still doing all the measures that we're recommending, the guidelines, then we're going to get less flu patients and less COVID patients. So if we can just do what's recommended, wear the face mask, keep your social distance 6 feet apart, don't gather anywhere, wash your hands often, we will have minimal amount of flu this year. But please get the vaccine, because we have to try to at least decrease the numbers of who's going to present to the healthcare system.
Very good. Dr. Weber, did you have something to add?
No, I just agree. Definitely get the flu vaccine for you, your kids, your whole family, your extended family. As in the hospital, we're seeing the number of inpatient COVID patients tick up lately. You really, one, don't want to be in the hospital at this point for any reason. And two, we don't want to end up depleting some of our resources on managing flu patients when we could manage that and prevent the flu by doing, the social distancing that we're talking about, and the mask wearing and washing your hands, but also by getting the vaccine. So I definitely agree with Dr. Afflalo. Get it for yourself and your entire family and extended family.
Very good. We'll take one more question, and I want to hear from Dr. Akridge with this one. I'll do two more questions. For games outside, because we're suggesting we take things outdoors, what types of games would you suggest, or even virtual, maybe scavenger hunt games that you guys know are available? Dr. Akridge, Dr. Weber, do you guys have any real specific suggestions for these types of games?
Well, I just want to acknowledge that our youth have really been impacted by the pandemic as it pertains to our student athletes. Life as they know it and their athletic competitions have really been impacted. And having two athletes of my own, I completely understand the difficulty and challenges. One of the things that we did very early on was really tried to implement some projects here at home, and kind of getting some arts and crafts and board games and things of that nature, and being able to play. So it still keeps up that level of competition. It's not as physical as they're accustomed to being, but that has been helpful in passing the time. The other thing, kind of keeping in mind of those that are quarantined together, or in, one family unit, engaging in some activities, physical activities with the kids. So we too did, family walks, or put a hoop outside, and my husband and I will go and, shoot baskets with the kids. So parents, it may mean you getting engaged where you may not otherwise have been with your kids' physical activities and the sports that they enjoy. But, in many, cases when there aren't, siblings that are in the same household, that is something that should be considered and recommended.
Very good. Thank you so much. Ladies, Dr. Akridge, Dr. Afflalo, Dr. Weber, you guys have been so vital throughout this conversation with answering questions as well as your presentations. And so we appreciate your time and your service to the community at large. We're going to go ahead and launch the poll one more time to see if our numbers shift a little bit. I will say that from the pre-poll, most of us, more than half, about 55% responded no, and 42% responded yes. So go ahead, take a moment, answer that question, and we'll see what if there's any shift one way or the other now having received such great information from our panelists. We'll take a few moments. Okay. I'm sorry, I'm reading the reading the responses they're shooting to me via text. Yes, so there was a big drop with our yes response. So ladies, job well done. You have done some great convincing to our viewers and our listeners tonight. So again, thank you so very much for your time and your service. Keep doing what you guys are doing in educating our community. We definitely need it, especially within our African American community, providing those resources. It is a huge help to us. And so with having said that, again, my name is Monique Brooks. I have enjoyed being your host this evening. And so on behalf of the Multicultural Health Foundation and Mental Health America, we thank you all so much for joining us tonight. Please be safe and stay healthy out there. Have a wonderful holiday, everybody. Good night.